Hi, I'm Dr. Srikanth Reddy, a senior ENT consultant and surgeon working in Udbhava Hospital, Mayapur. And today topic is adenoid hypertrophy. So basically the adenoids are nothing but a lymphoid tissue. It is usually asymptomatic, but some children will have susceptibility to these adenoid infections, and chronic infections and allergies will cause some children's they will have an adenoid hypertrophy, and that adenoid hypertrophy, that enlargement of adenoids will cause nasal obstruction, mouth breathing, and in some cases recurrent ear infections, and some children will complain of disturbed sleep due to the loud snoring. If any one of your children are suffering from these above symptoms like nasal obstruction, mouth breathing, ear infections, ear pain, and loud snoring during the sleep, and they have a disturbed sleep and lack of concentration while studying because of the lack of sleep due to snoring. So these children usually have adenoid enlargement. So it's very important to take to ENT physicians to evaluate what are the symptoms, and based upon that symptoms, we can decide what is the plan of management. So if the patient has a recurrent ear infections, and apart from the ear infections and ear pain, if the patient is also having the hearing loss along with the snoring, nasal obstruction, mouth breathing, then we can plan for adenoid surgery, that is usually called adenoidectomy, that is a removal of that enlarged or hypertrophied adenoid tissue from the back of the nose. This is usually done by a coagulation method. In our hospital, we usually use a coagulator to remove the adenoids. So post-adenoid complications are very rare, and usually the patient will recover within 4 or 5 days. And the patient or the children will have no nasal obstructions and mouth breathing from there on, and he has a good sleep because there will be no snoring and mouth breathing. So if surgery is being delayed, then there are complications of this enlarged adenoid hypertrophy. If the enlarged adenoid hypertrophy is there for a prolonged time, then the patient or the children might develop a typical peculiar adenoid faces. The adenoid faces usually have this long, elongated, dull facial-less expressions, and the patient may have a pinched nostrils and short upper lip, and usually the patients, these children will have a crowded teeth. So you should, whenever the patient or the children will have these adenoid symptoms, then it's better to have an adenoid surgery at the right time so that the patient doesn't develop these complications. So it's better at evaluate this based upon the symptoms. It's better to evaluate and do the right treatment at the right time so that the children doesn't affect in the future. Okay, thank you.